Yeah, hi everyone. The topic is PCI coding, percutaneous coronary intervention. Let's discuss about how to code the PCI in medical coding. If you see here, what is percutaneous coronary intervention? That's what PCI. What is percutaneous coronary intervention? So basically, it is a non-surgical procedure which used to open blocked or narrowed heart arteries. Okay, so it's nothing but a blocked or narrowed heart arteries, and this is also known as coronary angioplasty. The angioplasty is, the surgical repair of the blood vessels. So they are going to perform on a blocked arteries or narrowed heart arteries, and this is also known as a coronary angioplasty. And how it works, if you see here, like the procedure is minimally invasive and they will use like a small puncture rather than a major open surgery Sunday, and a doctor inserts a thin tube called a catheter through an artery that would be from the wrist or a groin region, and of course they are going to use like x-ray images to guide, or they guide the catheter to the heart, and a small balloon at the catheter's tip is inflated to push plaque against the artery walls only. Here you can see on the image, the doctor is using, with the help of the catheter, and here you can see which is a small balloon-like structure, right? So this main function, this is what catheter tip, at the tip of the catheter, you can see there is a balloon-like structure, right? So this will pushes the plaque against the artery walls. So it is simply, as I told you right here, which is a blocked or narrowed heart arteries, they were going to perform this PCI procedure. And it is a life-saving treatment to restore blood flow quickly. And so this is what a PCI, percutaneous coronary intervention. And if you see here, like steps to code PCI, first step, identify the vessels treated. So it makes very simple, and like whenever you're working in cardiology coding, if there is a scenario of PCI coding, follow these instructions. Like first identify the vessel treated only. So determine like which of the five major coronary arterial territories of the branches were treated. You can see here LM left main, left anterior descending, left circumflex, right coronary, and of course the ramus intermedius only. All these are the major coronary arterial territories, and our first step, we need to identify which artery they are doing, for which artery they are doing the procedure. What procedure we are discussing? PCI. And the second step, if you see, determine the level of intervention and review the entire operative report to find the most intensive service performed in each vessel. Only report one code from the PCI family for a single artery, and it branches choose the highest level. And so there is a hierarchy in this one. If you see in here, angioplasty only, yeah, we can code only angioplasty. And stent placement, if for example they're performing angioplasty and stent placement on the same vessel, we will only code stent placement only, as it includes angioplasty. And atherectomy performed, and angioplasty also included in atherectomy. If in case atherectomy and stent performing, we have a combination code atherectomy with stent. This is a high intensity. This is the hierarchy we need to follow if they are performing all on the same vessel and the same artery. If it is a different artery, we'll code it separately. But if it is the same artery, follow this instruction. Suppose angioplasty is there, stent placement is there. We don't code angioplasty because that is included in stent placement. Okay, just this is very important to follow it. Okay, hierarchy. And let's see some points to remember here. Identify territory, like determine, as we discussed in the previous slide, like determine like which of the five major arteries were treated, like as we know, LML, DLC, RC, or RI, and code the highest service and record the highest service. Like choose only the most intensive procedure per vessel. Example, if you see here, if both angioplasty and a stent were used, only code for the stent. That's what, right? Hierarchy we are following here, no? Angioplasty and stent placement. In the stent placement, angioplasty is included. We don't code that angioplasty separately. So in this example, if we see here, both angioplasty and a stent were used, only code for the stent only. Then check for diagnosis. Check if it was emergency AMI, acute myocardial infarction, or a long-term blockage, which is a chronic total occlusion, because we do have a separate set of codes based on the condition also. And other one, we need to follow the NCCI edits, which is nothing but bundle services or unbundled services. And in this case, we do not code separately for catheter insertions or imaging because already they are included. Already they are included. We don't code this separately. And modifiers, of course, we can use these modifiers, anatomical modifiers like LD, RC, LC or RC, LM, to tell the insurer exactly which artery was fixed only. So this one is also important to give the modifiers only. And finally, the most important one, link diagnosis. So match the procedure to the correct ICD-10 code to prove medical necessity. If it fails to meet the medical necessity, it will get denied from the insurance company. So this last point is also very important in order to get the 100% payment for that particular procedure. So all these points, please remember, and it is easy to code the PCI in surgery coding. Let's see what are the CPT codes we are using for PCI. 92920, which is coronary angioplasty, single major artery and its branches, and 92924, coronary atherectomy with angioplasty, single major artery and its branches, and 92928, stent placement with angioplasty, single major artery and its branches for one lesion. And 92930 is for complex stent placement, and this will be used for two or more distinct lesions, or sometimes a bifurcation lesion requiring treatment in both the main artery and side branch only. So if it is a single means, of course, we can use 92928. If it is a two different lesions or bifurcation of the other main arteries, we can use 92930. 92933 is a atherectomy and stent placement with angioplasty, single major artery and its branches. This is a combo, right? 92933 atherectomy and stent only. And 92937 PCI through a coronary artery bypass graft, single major artery and its branches. So along with the CABG procedure, coronary artery bypass graft, and also they're performing this PCI. Yes, we can use this 92937 only. And 92941 is for revascularization during AMI, as we told in the just previous slide, right? So we need to check the condition also, whether it is a AMI or a total occlusion. So if it is an AMI, we can use 92941. If it is a total occlusion, we have a code 92943 only. And here also we need to check whether what is antegrade approach and whether they are doing for antegrade and retrograde. Because so if it is only for antegrade, that is nothing but from proximal to distal end only. That is the meaning of antegrade approach. So if they are only performing for antegrade approach, yes, you can use 92943. And if they are using antegrade and retrograde, we have a combination code which is 92945. So these are the key terms we need to check in the operative report. Then these are the other add-on codes and where you can see 92972 coronary lithotripsy. This is a shockwave therapy to break up calcium only. And 92973 is the aspiration thrombectomy. And the other codes 92978 and 92979, this is a intravascular ultrasound for optical coherence tomography OCT, initial and additional vessels. So we need to check whether that's an initial vessel or also they are performing for additional vessels. Accordingly, we can use the set of codes only. So all these codes you can find in your CPT 2026 updated version book. Let's see some scenarios for a better understanding here. For example, a patient has a 90% blockage in the left anterior descending artery, and the doctor performs balloon angioplasty followed by the placement of a single drug eluting stent only. So if you try to observe here, we perform the angioplasty, and stent. So what we will code only stent. So the code for this one is 92928 ND, and we are giving LD modifier because this indicates that performed on left anterior descending artery. And if you see the description of the CPT code 92928, the stent placement with angioplasty, single major artery and its branches for one lesion only. So now it's clear, right? Because they perform angioplasty and stent. As per the hierarchy, we will only code the stent only. We will only code the stent. If you see in the scenario number 2, a physician treats two separate distinct blockages in the right coronary artery. One stent is placed in the proximal right coronary and another in the mid right coronary. So two different blocks are there now. So this is nothing but complex stent placement only. So we have to use 92930 and we are using RC. This RC indicates right coronary artery. Right coronary artery. So this one is considered as a complex stent placement and the 92930 is a complex stent placement used for two or more distinct lesions or a bifurcation lesion requiring treatment in both the main artery and its side branch. And if you see in scenario number 3, in the left circumflex artery, the doctor performs an atherectomy to break up heavy calcium, then does a balloon angioplasty, and finally place a stent only. If you try to observe here, atherectomy, angioplasty, and stent. So we have a guideline, right? Whenever they perform atherectomy and stent, we have a combination code. Of course, angioplasty is always included, and this is the lowest one. So now atherectomy and stent placement, we have a code 92933, and we are giving a modifier LC, and LC indicates left circumflex artery. So finally, the answer is 92933, and the description for that CPT code is atherectomy and stent placement with angioplasty, single major artery and its branches only. So these are the few scenarios. And this what if you want more scenarios or more information, always reach out to this below number. And thank you for watching. Please like, comment, and share this video with your friends. And our services, we provide CPC certification training, CCS certification training. Of course, the specialty coding training, who are looking for a class training or you want to upgrade your skills. So all the specialties we are providing training. And along with this, other services, we have provide membership renewals or CU submissions, exam registration, career counseling, and job placement assistance. So many we will provide the services, and so please reach out to this number and definitely we will help out your career growth. And this is Krityan Academy, and you can always reach out to this email ID. If you have any queries, please send an email to this one, info@krityanmedicalcoding.com. And this is our official website. Once again, thank you, friends. Please like, comment, and share this video with your friends. Thank you, everyone.